Hi, my name is Megan Michaels. My roleplay client was Sao St. Fort, whom I treated over the last couple months. Sao presented to me as a 42-year-old Haitian American woman living in Orlando. Her date of birth is 8/23/83. She resides at 1234 Main Street in Kissimmee, Florida. She presented to me as a self-referral. She didn't indicate that she was having symptoms of schizophrenia, but it became apparent after talking to her that that's probably what her diagnosis was. She denied any suicidal or homicidal thoughts, any plans or behaviors related to homicide or suicide. She did report that she'd previously been in counseling, but it had been several years. She indicated that her husband really requested that she be seen by a therapist because he stated that she was withdrawing from him, withdrawing from their family, and just not acting quite herself. She lives with her husband and her two sons, who are 11 and 9. Her oldest son is 23, and he lives at home when he's not at college. Sao has several advanced degrees and previously worked in the corporate world for over 10 years before recently resigning to focus on her master's in clinical mental health. Sao reported to me that she does struggle with her self-esteem and feels like she's not qualified to be in this program where she will eventually be eligible for a license in clinical mental health therapy. She indicated that her family history involved her parents who were very hard on her regarding school and her performance in school and her behavior at home. She indicated that she often feels like there is a voice inside her head that tells her she's not good enough. Sao has named this voice Keisha. Sao indicated that she sometimes sees Keisha. She has seen Keisha and heard her for more than 5 years, and she's not told anyone else about this. Again, she denied any homicidal or suicidal ideation, any self-mutilation history, any history of substance abuse, and any major medical problems. However, she did report that she had a miscarriage over 10 years ago. She was being seen by an OBGYN, and the practitioner was not able to find a fetal heartbeat, and she was sent to the hospital. Sao believes that she delivered a baby boy that was taken away by the government to be used as research, and the voice Keisha advised her of this. She denied having previously been prescribed psychiatric medication until till now. She denied any inpatient treatment instances, both voluntary and involuntary, and denied any family history of substance abuse, but reported that she's a grandmother who she believes may have struggled with schizophrenia. She involves 2 incidents with her grandmother needing to be involuntarily hospitalized for psychiatric care, including a time that she locked herself in a bathroom with Sao's young son. The grandmother was from Haiti and had a history of an involvement with the practice of voodoo, which may have negatively impacted her mental health. The family, as an extended family, didn't discuss this, and no one knows if she had an official diagnosis prior to passing away. When Sao first came to me, she was neat, clean, and appropriately dressed. She appears to be a good dresser and grooms herself appropriately. She did not make any eye contact during this first session and frequently looked down at the floor while she spoke. She spoke very slowly during the sessions with very little emotion in her voice and had an overall very flat affect. She often spoke of this voice Keisha during our first visit and appeared to accept Keisha's presence in her life as normal and unbothersome. Her speech patterns vacillated between normal and composed to very, very disjointed, and she took a while to answer questions sometimes. Her judgment appeared to be clouded by her preoccupation with the voice in her head, Keisha. She was able to clearly speak her thoughts, but they were often disjointed and sometimes slurred. She knew who I was, she knew where she was, and she knew who she was, but her judgment just seemed to be clouded by this voice. So this is what started to get me to think that possibly she had schizophrenia. According to the DSM-5 TR, Seo meets many of the criterias, including hallucinations, delusions, disorganized speech, and other negative symptoms like a flattened affect and cognitive deficits. Additionally, as time went on, her hygiene would vacillate between appropriate and inappropriate, and she would indicate to me that it was difficult for her to sometimes shower and take care of herself. After interviewing her twice, I believe that she was suffering from schizophrenia, especially because of these symptoms involving the woman named Keisha, and Keisha not being able to be seen from anybody else. The DSM-5 indicates that at least 2 criterion A symptoms should be present for the diagnosis to be appropriate for the patient, and Seo meets at least 2 criterion. She's still suffering from delusions over 10 years ago, in which she believes a woman named Keisha speaking to her, but also that her young son, her miscarriage, the fetus was taken by the government and used for medical research. While utilizing the HUDAS, she scored a 31 for overall disability, a 40 for cognition, 0 for mobility, 10 for self-care, and 50 for getting along, 42 for life activities, and 33 for participation. My initial treatment plan was that she should return to therapy weekly for further evaluation and observation. I suggested that her husband come along to some of her sessions and maybe even her adult son. My plan was to explore additional family history of schizophrenia, and I also referred her to a psychiatrist for a full psychiatric workup, and as well as referring her to a primary care physician for physical health exam to rule out any physical health problems that may be related to her psychological symptoms. I was able to rule out anxiety, generalized anxiety disorder. Initially, I thought that possibly could be her diagnosis due to her inability to look me in the eye. She was talking about being scared sometimes, talking about her heart racing sometimes, and just not being able to fully express what was going on. But as she continued to speak, I realized that it definitely was schizophrenia. Throughout our time together, on October 21st, 2025, she arrived to the session disheveled, unkempt hair, wrinkled shirt, and reported that she had not showered in 2 days. She stated, though, that she was doing fine, and Keisha informed her that it was safe to come to the session, but she should be cautious on the feedback that she received. Seo reported that she was under a tremendous amount of stress at that time because of the graduate program that she's involved in. And she reported that she felt like withdrawing from her husband since the last session, but she did make an effort to go on a date with him. She reported that she had seen the psychiatrist, but she was surprised that he gave her a diagnosis of schizophrenia. She reported that she was willing to cooperate with him and work towards managing the new diagnosis, and she was prescribed risperidone 2 milligrams by mouth per day. She indicated at that time that she was taking the medication. As time went on, Seo experienced a crisis on November 4th, 2025. She reported that a voice in her head, Keisha, had started to tell her to harm herself or to protect her family. Keisha was insisting that Seo should cut herself with a knife or razor or something bad will happen to her sons and husband. Seo was able to admit that Keisha's not real, but that she feels very real and the voice is very clear. The Plaid Pals assessment was utilized to assess Seo's potential suicidal risk. She denied having a suicide plan, and she denied having any lethal weapons available to her and any previous suicide attempts. She had great support from her husband at that time and throughout my time seeing her, and she finally told her husband about the voice at that time. At that time, she had not experienced any grief or loss, and there was no concerns about substance abuse. Additional suicide or lethality assessments were not appropriate for her or her crisis. Reality testing was utilized, and she was able to verbalize that she's concerned by the voices, but she knows Keisha's not real. She agreed to take several steps to relieve her auditory hallucinations and to protect herself. with a safety plan, including a strict daily schedule with a balance of work, school, family life, and other responsibilities. She signed a safety plan saying that she will see her psychiatrist, who didn't change her medication, but indicated to keep taking it as needed. She agreed to follow as prescribed, not as needed. She agreed to follow a strict sleep schedule, eat a balanced diet, and journal her thoughts and hallucinations daily. Seo agreed to check in with her husband, her friend Jane, and her sister Kim daily and keep them aware of her progress. I contacted her husband after she signed a release and requested that he attend a session with her and to attend subsequent sessions until she's stabilized. Seo was aware that I would make attempts to hospitalize her if she was unable to keep herself safe. The crisis ending will be measured by a 6-week period in which Seo reports that she is not hearing Keisha's voice at all. She agreed to be hospitalized voluntarily if needed, agreed to call 911 if she was close to harming herself, and she signed a no suicide, no harm contract. She indicated that she will comply with her medication regimen as she's already been referred to a psychiatrist. As time went on, she began to stabilize. I saw her again on the 11th, and she was neat, cleaned, and appropriately dressed at that time, and much more alert and positive. She reported that she had not heard Keisha since the last episode on the 4th. She participated in that session with increased interest in her treatment plan. She is coping well by utilizing the methods discussed in her therapy, which included regular sleep regimen, a regular schedule, checking in with her friend Jane, her sister Kim, and her husband every single day, and continuing with the psychiatrist's recommendations. I saw her again on the 28th, and she appears to be continuing to do well. She couldn't recall a time that she had heard Keisha since the last session. She indicated that she continued to experience stress in the graduate program, but exercise and sleep have helped keep her motivated and on track. Her husband has begun to see his own therapist. She participated in that session very enthusiastically and at that time was working towards her goals and managing her symptoms well. A follow-up was scheduled for the 24th, which was our last session. She was neat, clean, and appropriately dressed at the time and was looking forward to the holiday. She was looking forward to a break from graduate school so she can rest and focus on her continued healing. She reported that she feels motivated to keep up with an appropriate hygiene routine and denied hearing Keisha or having any suicidal or homicidal thoughts. A follow-up session for the new year was scheduled. I didn't refer her to anyone else as she's seeing a psychiatrist, and she agreed to come back and see me in the new year once her insurance restarted again. So my termination summary for her indicated that her prognosis was very good. She is aware of her diagnosis. She's aware of what that all entails and what she needs to do to manage it. She has a very strong relationship with her husband, good support from him and from friends. She has reported that her symptoms are reduced and her time management skills have improved. She is committed towards the goal of excellent personal hygiene, a strong routine, continuing her medication as prescribed, and committing to regular therapy, and is motivated to finish her graduate program. She has admitted that her overall symptoms have reduced. So that is Seo. I saw her a total of 8 or 9 times. And if she were my real patient, I would continue seeing her regularly. And that is my assessment on Seo Saint Fort.